Hello and welcome to the session today, where we will be introducing you to the new inclusive features on Surgery Connect. My name is Amanda. I'm one of the trainers here at Exon Health, and my colleague Cindy Roberts is also here joining us. If you've got any questions as we're going through, please can you pop them in the Q&A box where Cindy will endeavour to answer them. She'll also be putting any relevant links into the chat box for you as we go through the webinar today. I think there's some more people joining. Just give them a couple of minutes. Okay, so the webinar will be recorded today, and you will receive a recording of the webinar in due course. Let's get started. What are the new features that we've launched here at Exon Health? First of all, we have got website widgets. So these are customizable web pages on your surgery website that display live real-time queue status. This gives realistic expectations for the patient before they even pick up the phone, therefore reducing the frustration of waiting in a long queue. We've also got voicemail transcription now. In the past, the problem was listening to long rambling voicemails. Now, staff can now read the transcript at a glance. They can identify urgent needs instantly, they can copy text directly and manage high volume lines, like repeat prescriptions, without having to sit through minutes of audio. We have made queue position web page enhancements. In the past, generic callback pages didn't provide the specific information a patient needs for their unique call. The solution now that we offer is multiple group-specific web pages. If a patient requests a callback for a specific department, the URL and content they see are tailored to that choice, ensuring the information is always relevant, therefore, to their call. Silent monitoring. Standard users currently lack an accessible way to initiate silent monitoring support without undergoing a formal supervisor escalation process. Silent monitoring can now be activated directly from the phone bar, enabling seamless peer observation. And supervisors can now listen in. They've got listening capabilities as well, therefore helping their staff deal with those difficult calls. By the end of May, we hope to have released the enhanced reporting features to Surgery Connect customers. These will sit in the reports console and bring so much more to reports, allowing you to analyse the data and make informed decisions. So let's have a look then, first of all, at these new features. And the first one I want to talk about with you today is website widgets. So website widgets are customizable digital web pages that display live queue status on practice websites. They serve as a digital window, allowing patients to see exactly how busy the surgery is in real time. There are two widgets available, one which will display the number of callers queuing, and the other will display the current longest wait. The widgets can be set to show data for specific call groups. So for example, you may just want to show data on the appointments queue, and therefore the widget can look just at the calls queuing up for appointments and give that relevant information. So they can be customized. The widgets can also be customized to match with the surgery's existing branding on the website as well. So giving callers access to this information via the practice website allows them to make an informed choice as to the best time to call the surgery, therefore reducing the frustration of waiting in a long queue, or perhaps they might consider using online services instead of making that call into the surgery. So I'm going to give you a quick demo on how to set up the website widgets. They are very simple to set up and create on your service with us. So I'm just going to change the screen here. So the application where you set up the website widgets is our service delivery console. Okay, so you can access our applications, as you probably know, by logging into your SSO, or you can access them from the phone bar. Select the service delivery console. And when you're in the service delivery console, on the right-hand side, take yourself into the advanced tab. And then we need to select the box that says website widgets, manage queue widgets. And then you simply click create new queue widget here. So click in here. Now I've created one earlier for appointments, so I'm just going to edit this one just to show you just the fields that will pop up when you create a new widget. So when you click on create new widget, you will get the various fields that need to be populated. So we've got the widget name. Okay, if you're going to create one for your appointments queue, then we're going to name it appointments. You might want to create a widget that looks at the calls queuing up for general inquiries. So you'd name it general inquiries, etc. So there are two types of widgets I mentioned earlier. We've got callers in a queue, and the other type of widget we can put on our website is current longest. So select the widget you would like. I'm going to go for callers in the queue. On the right-hand side, group to display. So if I wanted to look at calls queuing up for my appointments group, I select the appointments group. But if I click on the drop down, it will list all of the groups on your service that you've got configured with us. You might want, if you've got a general inquiries group, you might want the widget to look at the calls queuing up for the general inquiries group. If you select all, then the data, the widget will look at all the calls queuing up in all of the groups configured on your service. I just want it to look at, however, as I say, the appointments calls. So that's the group I'm going to select. Then we can edit the look of the widget. So again, you will probably want it to be the similar look to the rest of your website. So we've got the font color here. Now there's a preview of the widget on the bottom here, so we can go in and change the font color. As you can see, it's changed it here. We can change the font size on the slider. So you can see I'm making it smaller on that widget or larger. Okay, so you've got the font color and font size. On the right hand side, icon color. Again, select the relevant color that you'd like. And you can see that's changed here on the widget. And again, we've got the icon size. We've got the slider there that will change the size of our icon on your website. So then we've got the corner radius. So at the moment you can see I've got slight corners on my widget. Again, I can make the corners larger, or I can remove them altogether and I can have just a square widget, as you can see. So you've got the corner radius there. And then finally we can frame the widget. I've got a border at the moment around, and I can change the color of my border there as well. You can remove the border altogether, select none, or you can have a shadow there on the border. Okay, so just set your widget up. You have got a preview of the widget here. That's how it will look when it goes onto your website. Save the changes, and then you need to select copy code. And then you give the code to the member of staff at your surgery who looks after your website, or perhaps you have an IT company who looks after the website for you. But you would need to give them the code in order for them to put the widget on the surgery website. Okay. So where the widget goes on the website is really important, but you need it to be placed in a prominent position on the website so that patients can obviously easily see it. So a widget only works if a patient sees it before they start, queuing up, and before they start getting frustrated waiting in the long queue. So the home page is essential. At least one widget must live on the primary home page. If a patient has to hunt through submenus to find the queue length, the opportunity, therefore, to manage their expectations is already lost. Okay, so really important where the widget goes on the website. A good place to position a widget is near the Contact Us icon or perhaps the Request an Appointment link. This ensures the patient sees the live wait time or queue length exactly at the time they are deciding whether or not to call the surgery or to use other alternative services. Okay. So there's also call queue widgets are not just available on Surgery Connect, but they're also available in practices using Surgery Assist. So for the Surgery Assist practices using Surgery Assist, the call queue widgets are placed within the digital assistant and have the same functionality as the website widgets, which is providing the patient with real-time call waiting information so they can decide whether to remain in a queue, call the practice, or use alternative options. Surgery Assist queue widgets are configured in exactly the same way as a website widget. So again, you go into the service delivery console and you set them up in exactly the same way I've just shown you. The only difference is when you create the code for the widget, it's pasted into the bot settings, obviously, rather than the website, your website settings. So it's created in the same way, but the code that it gives you is placed in the bot settings in the Surgery Assist portal, rather than the surgery website. If any changes are made on the widgets in the service delivery console, they will automatically be updated in the Surgery Assist digital assistant. So we, as always, have lots of supporting resources for website widgets. We've got our Help Centre guides for Surgery Connect and Surgery Assist. And there is, of course, our Academy, which provides a range of CPD accredited e-learning courses. Okay, we've also got practice case studies as well. I think the one we have for website widgets is the Bay Medical Practice, if you want to have a look at that as well. All right, so next I'd like to talk to you about voicemail transcription, our next additional feature that we've got for you. So voicemail transcription. So following the introduction of voicemails to the communications window, we've added a transcription feature. So this will allow users to check the content of a voicemail without having to listen to the whole message. And it can easily be copied, and the content of the message can be copied to the clipboard. Advanced speech recognition converts the spoken words into written text for you, which is then displayed directly in the communication window. This feature revolutionises how you manage messages. So by quickly scanning the transcriptions, staff can prioritise urgent requests. They can identify key information and save the time previously spent listening to the entire voicemail. So let's have a look now then at the voicemail transcription. So at the bottom of my screen, I am moving around my phone bar. Okay, I hope you can all see that okay. Just moving it around the bottom. So I'm going to expand the phone bar here. And I'm just going to point you towards the communication icon here. So you can see the communication icon has a little orange notification circle on the right-hand side there. So it's notifying me of something new. If I click into the communications icon, it will open the communications window, as you can see here. And again, the little alert icon is on my voicemail on the left-hand side here. So I'm going to click into voicemail. Two types of voicemail boxes. We've got user voicemail and we have group voicemail. User voicemail is for those of you who perhaps have a direct dial number. You may have voicemail set up to answer those calls you're unable to answer on your direct dial number. And there's also group voicemails, which are callers that come into groups and leave a message in that group voicemail box. So I can see that the notification is in my group voicemail tab here. So I'm going to select the group tab. And at the top is a new voicemail message that's been left. I know because it's got the orange circle here. I can see the time the message was left, 12:06, and I've got the caller's number here as well. And I can see that the voicemail has been left in the prescription group. So it's come into the prescription group at the surgery. I'm going to click into the message. And you can see I've got the voicemail transcription here. And I can read what it says. Hello, this is Sarah Green. I need to talk to somebody regarding my prescription. Please call me back as soon as possible. And the number there is left. So that voicemail transcription there, I can copy if I need to, copy transcript. I can click on here. The tick confirms it's been copied. If I wanted to paste that voicemail somewhere else, then I could. Okay, so really quick, nice, easy way to access the voicemails there. And once you've heard or once you've opened the voicemail message, the notification on the communication icon disappears, as you can see. Okay, back to my slides. And as always, we've got the supporting resources as well for that voicemail transcription. So that's all in the Help Centre, guys. And we've got, as always, a case study there as well for you. And the relevant courses are in our academy. I'm going to move on now to patient callback queue position web page enhancements. As many, I'm sure you are all aware, when a patient requests a callback from a practice, a free of charge SMS is sent to the patient with a link which takes them to a web page. Here it confirms that the surgery has got the callback, and it also shows the caller move up the queue, therefore preparing the caller for when they can expect a callback from the surgery. So we've introduced the ability to configure multiple queue position web pages across a service, which means that web pages can be tailored for individual groups. For services with multiple sites, it also means that the links can be tailored to those specific sites as well. Previously, it was only possible to configure a single web page for the entire service, which meant that all the groups using queue position web page feature had to use one web page configuration. So the benefits now, of course, is that we've got targeted information. So the enhancement allows for the display of more relevant information to the patients by tailoring the queue position web page content based on the group callback, the group the callback was booked for. For example, an appointments callback or a prescription callback from the prescription group. Enhance call flow efficiency. So the feature contributes to increasing the efficiency of the call flow and helps utilise other Surgery Connect features. Improvements for multi-site services, as I previously mentioned, so services with multiple practices can now create web pages with site-specific information, increasing the relevance of information provided to the patients. So let me show you now how to set up the new enhanced patient callback queue position web page. So again, you do need to go into the service delivery console. Okay, so it's the same application as before. So select the service delivery console. And again, when you're in the service delivery console, on the right-hand side, select the advanced tab. Get rid of my phone bar there, move that to the side. So we have here patient callback. So select manage patient callback. And then simply select create new web page. Okay, so again, I've created one earlier for prescriptions. So I've got prescription patient callback queue position web page here. So I'm going to edit that. So when you select create new web page, you will have the fields that you can see now that you need to populate. So the web page name. So this is going to be for our prescription queue patient callback from our prescription queue. So I'm going to call it prescription patient callback queue position web page. The surgery name, so that will show up on the SMS that gets sent to the patient when they select the callback. So we need to put the surgery name in there. The title, again, that will show up on the SMS that the patient receives on that callback confirmation. And then we've got the content field here. So this is where you can type in what you would like the patient to read on that SMS that they receive. It's a free of charge SMS, so you can, it's a great way of telling patients about anything new happening at the surgery as well. Perhaps you're doing the flu vaccine and things like that. So it's a free of charge text message where you can also tell patient about any promotions you're doing at the surgery. But in this case, we've got it quite simple. It says we no longer take prescription requests over the phone. You can order or repeat prescriptions via the NHS app. And then our team will be in touch as soon as possible. Please have your phone with you to receive our call. If you no longer require the callback, please use the cancel button above. So whatever you enter in the field here is what the patient will receive on the SMS text. And if I select preview, click on preview here, you will see how that SMS is presented to them. So it tells them has the surgery name at the top here. It tells them the position they are in the queue, and that will change as they move up the queue. They can click and select cancel the callback. They can tap and cancel that callback if they no longer need the surgery to call them back. And you can also see here the prescription information that I added, which is we no longer take prescription requests over the phone, etc. Please use the NHS app. So we're hoping that they will therefore cancel the callback and go onto the NHS app for their repeat prescription. So that is an example of the patient callback queue position web page. Okay. Again, all the supporting resources are here for you, and all the links will be in the chat for those as well. So we've got all the supporting documentation for the patient callback web pages. So now, silent monitoring, another one of our new features. Silent monitoring has been added as a new in-call feature as part of the 8.6.5 version release of PhoneBar. It allows an additional user to listen or to join on an active call via the PhoneBar. This can be used for training medical students, additional input when required, or just to listen to known difficult callers, be able to listen into those calls. Silent monitoring can be accessed via the PhoneBar by invitation or by listen in, whereby a supervisor can silent monitor an active call without notifying either participant on that call. Benefits of silent monitoring. Trainees, so new staff, can easily listen in remotely to experienced staff members while they're on their call, therefore helping them to learn how to deal with some of those difficult calls that come into the surgery. Supervisors provide a safety net for new staff or nervous staff by being able to step in if a call becomes complex or a little bit heated. So by supporting staff in this way, it ensures correct call handling and it reduces the pressure put on new staff. So my colleague Cindy and I will now show you that silent monitoring in action on the PhoneBar. So again, I'm going to bring my PhoneBar over. I'm just going to connect to a call. I'm just going to ring my mobile. Okay, so you can see now on my PhoneBar, I am talking, I'm on a call, and you can see the number of the caller I'm talking to here. So let's imagine I'm a new member of staff, I'm really having difficulty with the caller. So I'm going to call or see if my practice manager is available to monitor and to listen in and perhaps help me with the call that I'm on. So there's when you are connected to a call, there will be an icon on the phone bar here. And if you put your mouse over it, it will say invite someone to silent monitor. I'm going to click on the icon here. It brings up my colleague list. So I'm going to search for the member of staff. I can search by name for my practice manager, Hannah. They need to be available, of course. I can see that Hannah is available. And on the right-hand side, there's an icon here, invite Hannah Green. And if I click on here and I send an invite to my colleague Hannah, the practice manager, they will get notification on their phone bar. Their phone will also ring and they will be able then, you can see here, Hannah Green has joined my call. And the icon is now turned orange. I am now aware that my manager is able to listen into my call, and if they wanted, they would be able to talk to me as well. Okay, so that's how I would use silent monitoring as a member of staff, inviting somebody to join my call. I'm just going to hang up the call now. So the other way of using silent monitoring is if you're a practice manager, perhaps for you to silently monitor a call that's in progress. So again, bring up the contacts icon here, bring up the contacts at the surgery. Way my colleague Hannah is on a call. Okay, I can see that they're busy on a call. Of course, they need to be connected to a call in order for me to monitor them. So there is an icon on the right-hand side, start monitoring call. So if I click on here, monitoring request, I can click on the tick, and I can now listen in on that call without the member of staff knowing that I'm doing so. Okay, so I can now listen in on the call. If I click on the icon here, I can speak to the participants in the call. So at the moment, both are muted, neither participants on the call, the agent being the member of staff and the caller here, I'm both muted. If I want to speak to my colleague, I can simply click on the mute icon here and I can now talk to my colleague. The caller won't hear me. The caller is still muted. All right, so I could talk to my colleague here, that's the agent. If I also want to talk to the caller as well, I can unmute the caller and talk to both of them at the same time. Okay, so again, there's two different ways of using that silent monitoring, inviting somebody to join your call, or I can, when the staff at the surgery are connected on calls, you can silently monitor those calls. Okay, so I'm going to hang up there. Okay, and as always, we've got the supporting resources as well for the silent monitoring feature that you can all access as well. So by the end of May, we hope to have released enhanced reporting. We're introducing some new telephony reports by using Power BI and BigQuery. This release will include a refresh of all reports and dashboards, as well as some enhancements to the data. This will also mean reports will be in one place for Surgery Connect customers. Moving to Power BI has enabled us to make changes automatically without having to refresh the links each time, saving a lot of admin work and making it easier for the customers to access their reports. These enhanced reports will bring benefits to our customers. The visual data has been improved on the reports and advanced filtering has been implemented. Staffing insights give a more granular view of how staff are managing their time. The SMS reports now offer segment tracking, which means the practice can now accurately view SMS charges. One of our new reports is for Surgery Intellect. So Surgery Intellect is our new ambient scribe, which transcribes the clinicians' consultations for them using new AI technology. The new Surgery Intellect report shown here, and you can see, demonstrates how Intellect is actively improving surgery efficiency and clinician experience through the rich data insights. This report will be accessed via the reports console. So the overview page of the Surgery Intellect report is organised, as you can see, in 4 key areas that provide high-level summaries and granular audit data. So it shows the estimated time saved by using Surgery Intellect. Just move the phone bar out of the way there for you. So it shows the estimated time that is saved by the clinicians using Surgery Intellect. It shows the top 10 users of Surgery Intellect at the surgery. It shows Surgery Intellect by method, meaning was Surgery Intellect used via a telephone consultation, or was Surgery Intellect used for a face-to-face consultation. And finally, it shows the usage tree summary, which basically totals all the clinical notes that are created by Surgery Intellect and all the medical codes that have been used and created by Surgery Intellect, and any letters that have been generated as well. All right, so that's the Surgery Intellect report. So it really gives you a good idea. If you've got Surgery Intellect with us, you know how well it's being used and how much time is being saved by that new technology. Coming soon, we're also going to have Omni consultation reports as well. They'll be coming soon. All the supporting resources are there for the reports as well. So again, we've got the health centre guides. We've got all the Surgery Intellect reports on there. I think my colleague Cindy will put all the links in the chat for you. We've always got the Academy as well, that will have all the courses as well for all of these features I've been through today. Okay, so do have a look on the Academy as well. All the links should be in the chat box there. So that's it from us today. Thank you for attending today's webinar on the new inclusive features. I hope you found it interesting and I hope you found it useful. If you do have any questions, as I say, please do put them in the Q&A chat. We'll have a look at those in a moment and hopefully be able to answer those for you. Of course, you can always contact your customer success advisor here at Exon as well at any time if you would like to learn more about these new inclusive features or just need a hand setting them up. But thank you for joining us today. I hope that was useful for you all. Thank you.